So let's talk about what is the success rate of TAVI or TAVR. TAVI or TAVR has a very good success rate. So most of these patients are high risk for surgery, so their chances of mortality are very high. These are the patients in whom, when TAVR done, helps in significant improvement in quality of life, and the chances of any procedural complications or mortality are very, very low. So we're looking at patients who are high risk for any surgery. So this leads to lower chances of mortality. As of now, the success rate of TAVR is almost 90 to 95%. And because it is done in high risk, old age, frail patients, the post-operative complications of a surgery are avoided drastically. Another biggest reason for doing TAVR and TAVI is as TAVI is done through the groin, like a coronary stenting, the chances that the patient can move about, get discharged very quickly within 3 to 4 days is also significant. The patient has significant improvement in quality of life. The patient can get up and move and start going to work within a week. So all the complications secondary to a surgery, the long hospital stay secondary to a surgery, and the long-term follow-up because of a surgery can all be avoided when you're doing a TAVR, because the hospital stay is reduced drastically, the patient gets back to his normal routine, and also the patient is fit and fine and ready to do everything. For any queries, you can reach out to us in Department of Cardiology, Indraprastha Apollo Hospital. Thank you.